This is Dr. Vaishali and I'm reading from the book Spirit of Homeopathy, book written by Dr. Rajan Sankaran. Section 4, Materia Medica, chapter number 41, Situational Materia Medica of some remedy. Today's remedy is Rhus toxicodendron. The Rhus tox. The component of Rhus tox are anxious restlessness, fear of misfortune, fear of evil, forsaken feeling, fear of being murdered, anxiety wars in the house and better walking in the open air, anxiety about her children, anxiety from sitting bent, restlessness of the feet, superstitious and fearful. The above component indicate the Rhus toxicodendron has a tremendous fear that something is going to happen. Restlessness of the feet indicate an uncertain fear and inner restlessness which cannot be explained. Now, in Zincum metallicum, as a fear as if he had committed a crime but he does not know what. And in Medorerum, has a fear of misfortune as if something will happen and is clairvoyant. And in Rhus tox, has nervous apprehension, a dread, but does not know exactly why. These three remedies with restless feet have to be cautious and guard. These remedies are also superstitious. It is kind of inexplicable fear. In Rhus tox, fear of people, fear of being poisoned, fear of being murdered, and superstitious fear. There is also always a fear that something bad is going to happen, that someone is going to kill him. A threat inside the house. The threat inside the house. They are better walking in the open air. The threat is from something inside the house. So he always has to be on guard. If this threat is from outside, he can turn someone for support. But this is not found in Rhus toxicodendron. There is no clinging and no desire for company. So in Rhus tox, the threat is from his own people. He cannot turn to anyone for help and he has to keep quiet. Talk indisposition 2. Dwell on a past disagreeable occurrence after midnight. At night passes, the anxiety grows. Somebody in the house is going to murder him after midnight when he cannot shout, cannot tell anyone else, and there is no support. Weeping involuntarily, weeping causeless without knowing why, nervous, sad person, cautious especially after midnight, cannot tell anyone, forsaken feeling. It is the situation of the woman who has young children and is alone in the house with her husband who is capable of killing her. He is probably a drunk and there is no saying what is going to do. So she has to be on her guard. She is vigilant, nervous, tense and sad, etc. She is brooding, crying and unable to express her fear. She is dependent on her husband and worry about her children. I have found that the wife of the alcoholic usually require Rhus tox and their children usually develop the Rhus tox characteristic. The Rhus tox position is one of threat to the woman from her own husband due to his drinking or violent habit whereby he may lose control. Rhus tox is complementary to the calcea carbonica. A woman who is tense and nervous and feels that threat of being killed out of proportion to her situation would be a calcea carb who come from the world of security and cannot bear horrible things or any cruelty. If such a woman brought up in a secure environment and then marry a violent individual or a drunkard, she can develop a Rhus toxicodendron state. And a little anger on his part will make her react with a tremendous nervousness, fidgetiness and restlessness. Just as calcea carbonica with a threat from outside can go into the stramonium state, calcea carbonica with a threat from her own husband can go into the Rhus tox state. It has been observed that women who need Rhus tox will need calcea carb sometime. Similarly, children with a tremendous restlessness, fidgetiness, desire for cold milk and for hot bath and such other characteristic after being given, this remedy usually go into the calcea carb state. The actual situation may not be found in the life of the patient or in the life of his parent. If previously he was in the situation of the opposite or complementary remedy, then the slightest trigger is enough to move the person into the new state.